Hi everyone. Today's topic is a head injury. All must know about these conditions because in emergency department every day we are all seeing at least one cases of head injury due to the RTA and other causes such as a cell fall, sports or assaults. It is a very serious because death may occur at 3 points in time after the injury. The first one is the immediately after injury, second one is within 2 hours, and third one is within 3 weeks. That's why it is a very serious. It's just a overview. Before enter into the topic, we must know about these three main parts because in head injury these three parts are mostly involved in the head injuries. The three parts are scalp, skull and brain. The brain are protected by the scalp and skull. The next one is what is head injury. Head injury is that result in trauma to the scalp, skull or brain. What is TBI? Which means a traumatic brain injury. The terms head injury and the traumatic brain injury is used interchangeably in a medical lecturers, which means we simply say head injury or damage to the scalp, skull or brain caused by the trauma. When it affects the brain, they are called traumatic brain injury. Okay, let's see on one small example. The mild laceration on scalp may not be damage the brain, but the major trauma definitely affect the brain. That time we'll call it as a traumatic brain injury. Now we'll see about major types of head injury. One is open, the next one is the closed head injury. Open head injury means the skull is fractured and brain may be exposed to the outside, which means penetrating. Something break the scalp and skull and enter into the brain, which can cause temporary or permanent damage. This is the open head injury. The closed head injury means the skull remains intact but the brain may be damaged. The injury doesn't break the skull. Example, concussion or contusion. Later we'll see about what is concussion and contusion. This is open and closed head injuries. For better understanding, we'll know about some other types of head injuries. The types included concussion, contusion, skull fracture, laceration, hematoma, hemorrhage, diffuse axonal injury, cup and counter cup injuries. Next we'll see about what is concussion, contusion. One by one we'll see. The first one is concussion. This type of injury occurs when blowing to the head or body. Example, fall or other trauma. This trauma that shakes the brain inside the skull, which means it can cause temporary loss of function with no structural damage. The temporary loss of function can lasting for few seconds to few minutes. The next one is contusion. The damage to the brain tissues. It creates swelling and increases the pressure on the skull. The contusion is a more severe injury, and this type of injury, the brain can bruised and possible surface hemorrhage can occur. And this is the example for the skull fracture, linear fracture, depressed fracture, diastatic fracture and basilar fracture. The next one is the laceration. And this is example for the laceration. The first picture is post-accident condition. 15 cm anterior scalp laceration, 1 cm is deep. The second picture is example for the post-op condition. The large anterior scalp laceration was irrigated and debrided. The skin was closed with staples. The next one is the hematoma and hemorrhages. Hematoma means collection or clotting of blood outside of the blood vessels. This leads pressure buildup inside the skull. Hemorrhage means there can be a bleed in space around the brain, is called subarachnoid hemorrhages. Bleeding within the tissue means it's called intracerebral hemorrhages. Diffuse axonal injury. In this type of injury, the brain bounces violently inside the skull. The nerve cells and the nerve fibers are get stretched that make a permanent damage to the brain cells. This leads to prolonged loss of consciousness. Cup and counter cup injury means injury occurs under the site of impact with an object, and counter cup injury occurs the opposite side. Example, if you struck in a forehead, the damage occur under the forehead. Its counter cup means the damage occur opposite side is called counter cup injury. The next important thing is signs of head injuries. First one is the battle sign. Battle sign is also known as the mastoid ecchymosis. Is bruising behind the ear that indicate basilar skull fracture. This picture is example for the battle sign. The next one is the halo sign. It is a double ring pattern that can appear on a paper or a linen when CSF leaks with the blood. CSF leaks into ear or nose. It's also due to the high risk of infection or a meningitis, and this is also sign of possible injury to the internal carotid artery. Next one is the Raycon eyes, which means dark bruise around the eyes that resemble the dark circle. The brain injury that cause blood leak into the tissues. And the next one is the diagnostic evaluation. So what are all the diagnostic evaluation to do for the head injuries? The next one is the treatment process. The first initial treatment is airway, breathing, circulation, rapid sequences of intubation. The next one is the control of ICP. The controlling measure is position of head 30°, diuretics, furosemide, mannitol, and seizure control barbiturates. And next we'll consider about the calcium channel blockers, oxygen support, intravenous fluids, blood transfusion, corticosteroids, sedation and analgesia, temperature management. The next one is the surgical treatment for the head injuries. The first one is the craniotomy. Craniotomy means a section of skull is temporarily removed to access the brain and repair the injuries. Example, removing clot, clipping the blood vessels. Next one is the cranioplasty. Plasty means correction. Cranioplasty means a surgical repair to skull fracture. And the last one is craniectomy. Craniectomy means the section of skull is removed to relieve pressure on the brain in cases of life-threatening swelling. And finally, nursing assessment. Nurse should assess the airway, breathing, circulation, GCS score, neurological examination, sign of elevated ICP, and sign of CSF leakages. Thank you for watching, and we'll see in the next classes. Thank you.